Welcome to Strong Mind Stories, where we explore real human strength, the kind that comes from overcoming mental battles, life setbacks, and the challenges that try to break us. If that speaks to you, hit that like button and subscribe so you never miss a story. I actually read every comment, so drop your thoughts below, and if you have a story idea or a challenge you'd love to see explored, I want to hear it. Let's get into today's story. The Flood. Shauna Martinez stood in the hospital corridor, her hands shaking, tears streaming down her face, while her nurse manager led a confused, elderly patient back to his room. 10 minutes ago, Shauna had been fine. Completely fine. Doing her job, checking vitals, managing her patient load on the cardiac unit. Then Mr. Patterson, a 76-year-old recovering from a heart attack, had pulled out his IV for the third time that shift. When Shauna came in to reinsert it, he'd waved her away irritably. "I don't need that thing. I'm fine. You people are always poking me." Shauna had felt something snap inside her. A surge of emotion so intense it took her breath away. Frustration, anger, exhaustion all mixed together in a wave that overwhelmed her completely. "Then why are you even here?" The words had come out sharp, loud, with an edge that didn't sound like her. "If you're not going to let us help you, why did you come to a hospital?" Mr. Patterson had looked shocked, then hurt. Shauna had kept going, unable to stop. "I've reinserted that IV 3 times. 3 times. And you just pull it out. Do you know how much time that takes? How many other patients need me? If you don't want medical care, you can leave." Her voice had been rising, getting louder, more intense than the situation warranted. Mr. Patterson had actually looked frightened, had pressed the call button. And then, this was the part Shauna couldn't understand, she'd started crying. Not gentle tears, but sobbing. Full-body shaking sobs that came from nowhere. The shift supervisor had arrived, had gently taken Shauna's arm. "Let's take a break. I'll handle Mr. Patterson." Now Shauna stood in the hallway, completely out of control, crying so hard she couldn't breathe, with no idea why this was happening or how to make it stop. This was the third incident in 2 months. 6 weeks ago, Shauna had snapped at a family member who'd been asking questions about their mother's medication. Not just answered curtly, snapped, with an intensity that made the woman step back. 4 weeks ago, she'd thrown a patient chart across the nurse's station after a doctor had questioned her documentation. Actually thrown it. The chart had hit the wall. Everyone had stared. And now this, yelling at an elderly patient, then dissolving into tears, in front of everyone. Shauna was 34 years old. She'd been a cardiac nurse for 9 years. She was good at her job, competent, caring, known for her patience with difficult patients. But for the past few months, something had been wrong. Horribly wrong. Her emotions felt too big, too intense, like they were happening to someone else and she was just along for the ride, watching herself react in ways that made no sense. Small irritations would trigger rage so sudden and overwhelming she'd have to excuse herself. Minor disappointments would lead to crying that lasted hours. And the crashes afterward, the exhaustion, the shame, the confusion about what had just happened, were crushing. The shift supervisor, Karen, came back. "Shauna, I need you to go home. We'll talk tomorrow." "I'm so sorry. I don't know what. I didn't mean to, I know. Just go home. We'll figure this out tomorrow." Shauna drove home in a daze. The crying had stopped, but she felt hollow. Shamed. Terrified. What was happening to her? This wasn't who she was. She didn't yell at patients. Didn't throw things. Didn't have emotional meltdowns at work. But she'd done all those things. And the scariest part was that in the moment, she hadn't felt in control. The emotions had just taken over, like a flood she couldn't contain. At home, Shauna's husband Andrew found her sitting on the couch, staring at nothing. "Babe, you're home early. What happened?" Shauna tried to explain. "About Mr. Patterson. About losing control. About the crying. They sent me home. I think I might get fired." Andrew sat beside her. "This has been happening more, hasn't it? The intense reactions. The crying. I don't know what's wrong with me. I feel like I'm losing my mind. Maybe you should talk to someone. A therapist, or I'm not crazy. I didn't say you were crazy. But something's going on. And you can't keep going like this." Shauna wanted to argue but couldn't. Because he was right. She couldn't keep going like this. The next day, Karen called her in for a meeting with HR. They were kind but firm. 3 incidents in 2 months. Behavior uncharacteristic of Shauna's normal performance, but concerning nonetheless. They were placing her on mandatory leave pending a fitness for duty evaluation. We're not firing you, Karen said gently, but you need to get help. Figure out what's going on. You can't come back until you're cleared by a mental health professional. Shauna felt humiliation burning in her chest. 9 years of excellent performance. And now this. I understand. Shauna, Karen's voice was kind. I've seen you with patients for years. This isn't you. Something's wrong. Please get help. We want you back. But you need to be okay first. Shauna left the hospital feeling like she'd left a piece of herself behind. Her identity, her competence, everything she'd built. Shauna found a psychologist through her insurance. Dr. Linda Park, specializing in mood disorders and emotional regulation. First available appointment was in a week. That week was torture. Shauna felt like a failure, like she'd broken herself somehow. She'd have moments of calm, then sudden waves of emotion, anger at nothing, sadness about everything, anxiety about the future. Andrew tried to help, but she'd snap at him for small things, then feel crushing guilt, then cry, then feel exhausted and numb. I don't understand what's wrong with me, she told him after snapping at him for loading the dishwasher wrong. That wasn't worth getting angry about. I know it wasn't, but I couldn't control it. Maybe that's something the therapist can help with. Shauna hoped so, because she was scared. Scared she'd destroyed her career. Scared this was permanent. Scared she'd never feel normal again. Dr. Park's office was calming. Soft colors, comfortable chairs, box of tissues prominently placed. Tell me what's been happening, Dr. Park said after introductions. Shauna told her everything. The incidents at work, the intense emotional reactions, the feeling of being hijacked by emotions she couldn't control. And this is new? Dr. Park asked. Not something you experienced before. I've always been emotional, but I could manage it. Now it's like a dam broke. The emotions are too big and they just flood everything. Dr. Park asked detailed questions about Shauna's history, her childhood, her relationships, trauma, stress, sleep, diet, everything. Then she said, what you're describing sounds like emotional dysregulation. It can be a symptom of several conditions, but based on what you're telling me, I think we're looking at a stress-induced exacerbation of underlying emotional sensitivity. What does that mean? It means you're probably someone who's always felt emotions intensely, but you developed coping mechanisms that worked until recent stress overwhelmed those mechanisms. Now the emotions are breaking through stronger than you can manage. So it's not, I'm not going crazy. You're not going crazy. Your emotional regulation system is overwhelmed, but we can work on building better tools for managing it. Shauna felt a wave of relief so strong it brought tears. It can be fixed. It can be managed. With therapy, possibly medication, and learning specific skills. It won't happen overnight. But yes, you can learn to regulate your emotions better. Dr. Park explained the approach, dialectical behavior therapy, originally developed for borderline personality disorder, but effective for anyone struggling with emotional dysregulation. DBT teaches specific skills in 4 areas: mindfulness, distress tolerance, emotion regulation, and interpersonal effectiveness. We'll work on all of them. How long will it take? That depends. Usually several months of consistent work. Some people see improvement quickly. Others take longer. But if you commit to it, you will see progress. Shauna committed. The first few weeks were discouraging. Dr. Park taught her about the emotion regulation system, how emotions work, what triggers them, how they escalate. Emotions happen in waves, Dr. Park explained. They rise, peak, and fall naturally. The problem is when you fight the emotion or get caught in it. Either response makes it last longer and feel more intense. So what do I do instead? You ride the wave. Notice the emotion. Name it. Don't judge it. Let it peak and fall naturally. That's mindfulness of emotions. It sounded simple. It was incredibly hard. The next time Shauna felt anger rising, Andrew had forgotten to pick up her prescription. She tried the technique. Notice, I'm feeling angry. Name, this is anger. Don't judge. It's okay to feel angry. Emotions aren't good or bad. But the anger was so big, so overwhelming. Shauna felt it flooding her system, demanding action, demanding she yell or throw something, or she tried to breathe through it, but the anger just grew. She ended up snapping at Andrew anyway. I specifically asked you to pick that up. Why is it so hard for you to remember one simple thing? Andrew looked hurt. I'm sorry. I forgot. I'll go get it now. The anger crashed immediately into guilt. Then tears. Then that horrible exhaustion. Shauna called Dr. Park, discouraged. I tried the mindfulness thing. It didn't work. I still snapped at him. Did you notice the emotion and name it? Yes. That's progress. The first step is awareness. You can't regulate what you don't notice. Next time, try adding the stop skill. Dr. Park explained. Stop stood for stop. Take a step back. Observe. Proceed mindfully. When you notice the anger rising, physically stop what you're doing. Take a literal step back if you can. Observe what's happening in your body and mind. Then proceed mindfully. Choose your response instead of reacting automatically. Shauna practiced. Over and over. Small situations. Big situations. Andrew left dishes in the sink. Notice anger. Name it. Stop. Step back. Observe. Chest tight. Jaw clenched. Thoughts racing about how he never helps. Proceed mindfully. I'm feeling frustrated about the dishes. Can we talk about the division of labor? It worked. Not perfectly. Her voice was still tight. Her body still tense. But she didn't yell. Didn't snap. Chose her words. That was different, Andrew said, surprised. You actually told me how you felt instead of getting angry. I'm trying. I'm working on it. Small victories. But victories. Dr. Park introduced more skills. The tip skill for when emotions were overwhelming. Temperature, cold water on face. Intense exercise, paced breathing, progressive muscle relaxation. These are for crisis moments, Dr. Park explained. When the emotion is so big you can't think clearly. These techniques physiologically calm your nervous system. Shauna tried them. The cold water trick actually worked. Splashing ice water on her face seemed to short-circuit the emotional spiral. The intense exercise helped too. When she felt rage building, she'd do jumping jacks or run in place until the edge came off. It felt ridiculous, but it worked better than anything else she'd tried. 3 months into therapy, Shauna had another setback. She was at the grocery store. The cashier was slow, really slow, and Shauna felt the irritation building. Uncontrollable, intense, blinding. She tried her skills, noticed the emotion, named it, used stop, but the irritation kept growing into anger. The cashier was chatting with a customer, taking forever, and Shauna felt the anger peaking. Can you please hurry up? It came out harsh, loud. The cashier looked startled. Sorry, ma'am. Almost done. Shauna felt the shame immediately. She'd done it again. Lost control. Over something so minor. She left the grocery store and sat in her car, crying. In her next session, Dr. Park asked her to walk through it. I noticed the emotion. I used stop, but it didn't work. The anger was too big. What did you observe when you stepped back? That I was angry. That the cashier was slow. Did you observe what was underneath the anger? Shauna paused. What do you mean? Anger is often a secondary emotion. It covers something more vulnerable. When you stepped back and observed, what else was there? Shauna thought about it. In that moment in the grocery store, underneath the anger at the slow cashier, I was exhausted and overwhelmed, and I just wanted to get home. And I felt, she paused, I felt out of control, like I couldn't even get through a simple errand without things taking too long. There it is. The anger was protecting you from feeling overwhelmed and out of control. Those feelings are more vulnerable, harder to sit with. Dr. Park explained that emotional dysregulation often involved a stack of emotions happening at once, with the loudest one, usually anger or panic, covering the deeper ones. Next time you feel anger spiking, ask yourself, what's underneath this? What am I really feeling? Shauna practiced this. It was hard, sitting with the vulnerable emotions. Fear, overwhelming sadness, helplessness. This vulnerability felt worse than the anger. The anger felt powerful. The underneath emotions felt weak. But Dr. Park insisted, the only way through is through. You have to let yourself feel the vulnerable emotions instead of covering them with anger. 6 months into therapy, Shauna started to see real progress. She had a situation with her mother. A phone call where her mother criticized her for being on leave from work implied Shauna was being dramatic. The old Shauna would have exploded, yelled, hung up, cried for hours. This Shauna noticed the anger rising, used stop, observed what was underneath. Hurt that her mother didn't understand, fear that maybe her mother was right, shame about being on leave. She said calmly, Mom, I'm working on my mental health with a professional. I need your support, not criticism. If you can't support me, I need to end this call. Her mother had sputtered. I'm just trying to. I know you're concerned. But criticism isn't helpful right now. I need to go. She hung up, felt the emotions, hurt, anger, sadness, but didn't get flooded by them. They rose, peaked, fell. She sat with them, breathed through them, let them pass. And they did pass. In 20 minutes instead of hours. Andrew witnessed it. That was, that was really different. You set a boundary without losing it. I'm getting better. You really are. Dr. Park introduced the concept of opposite action. When an emotion is pushing you to do one thing, but that action won't help the situation, you deliberately do the opposite. Anger pushes you to attack. But if attacking won't solve the problem, you do the opposite. You approach gently. Fear pushes you to avoid. But if avoiding will make things worse, you do the opposite. You approach. Shauna practiced this with small things first. Frustration pushed her to slam cabinets. She deliberately closed them gently. Sadness pushed her to isolate. She deliberately reached out to friends. It felt unnatural, but it worked. 8 months in, Shauna met with the hospital's occupational health doctor for her fitness for duty evaluation. She brought documentation from Dr. Park. A letter explaining her diagnosis, emotional dysregulation secondary to stress, and underlying emotional sensitivity. The treatment she'd received, the skills she'd learned, the progress she'd made. Dr. Park believes I'm ready to return to work, Shauna said. With some accommodations initially. The accommodations were simple, regular check-ins with her manager. Permission to take brief breaks if she felt overwhelmed. Ongoing therapy requirement. The occupational health doctor reviewed everything. Asked Shauna questions about how she'd handle various scenarios. What would you do if a patient became verbally aggressive? I'd notice my emotional reaction. Name it, probably anger or frustration. Use my stop skill, step back, observe what's happening in my body. Check what's underneath, maybe fear or feeling disrespected. Then proceed mindfully. Use a calm voice, set boundaries, call for backup if needed. What if you felt overwhelmed during a shift? I'd use my tip skills if the emotion was too big. Take a bathroom break to splash cold water on my face. Do some paced breathing. If I needed more support, I'd talk to my supervisor. I'd rather ask for a break than push through and have a meltdown. The doctor nodded. You've clearly done significant work. 2 weeks later, Shauna got the clearance. She could return to work. The first day back was terrifying. Shauna felt like everyone was watching her, judging her, waiting for her to lose it again. Karen, her manager, met with her at the start of shift. How are you feeling? Nervous, but ready. We're glad to have you back. Remember, you have accommodations. Use them if you need to. I will. The first few hours were okay. Shauna took vital signs, administered medications, did her documentation. Everything routine. Then Mr. Patterson was admitted again. Different heart issue. And he was assigned to Shauna. She felt panic spike. This was the patient she'd yelled at. The one who'd triggered her meltdown. Shauna used her skills. Noticed the panic. Named it. Observed what was underneath. Shame about the previous incident. Fear of repeating it. Worry about how he'd react to seeing her. She did opposite action. Panic pushed her to avoid. So she approached. She went to his room. Mr. Patterson, I'm Shauna. I'll be your nurse today. I want to apologize for my behavior last time you were here. I was dealing with some personal health issues, and I handled the situation unprofessionally. I'm very sorry. Mr. Patterson looked surprised, then smiled. Water under the bridge, dear. We all have our days. I was being stubborn about that IV anyway. The relief was enormous. Thank you for understanding. Now, let's get you feeling better. Shauna made it through the shift. Had a few moments where she felt emotions rising. Frustration with a difficult IV placement. Overwhelm when 3 patients needed her at once. But she used her skills. Took breaks when needed. Stayed regulated. At the end of the shift, Karen checked in. How'd it go? Good. I had some challenging moments, but I managed them. I'm proud of you. This couldn't have been easy. It hadn't been easy. But Shauna had done it. Had stayed emotionally regulated through a full shift. Over the next months, Shauna continued therapy and continued applying her skills at work. There were still hard days. Still moments when the emotions felt too big. But she had tools now. Ways to manage the flood instead of being swept away by it. 1 year after her meltdown with Mr. Patterson, Shauna was asked to mentor a new nurse. The nurse, Taylor, was struggling with the stress of the job. During lunch one day, Taylor confided, "I feel like I'm always on the edge of crying or yelling. The stress is so much. How do you handle it?" Shauna thought about her answer carefully. "I had to learn emotional regulation skills. The hard way. I actually had to take leave last year because I wasn't managing my emotions well." Taylor looked surprised. "Really? You seem so calm." "I'm not naturally calm. I feel things intensely. But I learned techniques for managing those intense emotions. For noticing them without being controlled by them." "Like what?" Shauna shared some of her DBT skills. Stop. Mindfulness of emotions. Opposite action. Tip for crisis moments. "It sounds like a lot," Taylor said. "It is at first, but it becomes automatic. Now when I feel myself getting flooded, I have tools. I don't have to just white-knuckle it or fall apart." "Do you think I need therapy?" "I think everyone could benefit from therapy, but especially in high-stress jobs like this. Learning to regulate your emotions isn't weakness. It's a skill, like learning any other medical skill." Taylor looked thoughtful. "Maybe I'll look into it." Shauna hoped she would. Hoped she wouldn't wait until she had a meltdown to get help. That night, Shauna told Dr. Park about the conversation. "How did it feel to share your story?" "Good. A little vulnerable, but good. Like maybe all that struggle was worth something if it helps someone else. That's meaning making. Taking your painful experience and using it for good. That's growth." Shauna thought about the journey. From that day crying in the hospital hallway, completely out of control, to now, stable, managing, able to help others. "I still have hard days," Shauna said. "Days when the emotions feel overwhelming. You always will. You feel things intensely. That's part of who you are. But now you have skills to work with it instead of being destroyed by it. Is it okay that I still struggle sometimes?" "More than okay. That's being human." The goal was never to eliminate emotions or never struggle. The goal was to give you tools so when you do struggle, you can manage it. 2 years after starting therapy, Shauna was doing well. Working full-time, managing her emotions. Still in therapy, but less frequently, once a month for maintenance. She had a hard day at work. Multiple difficult patients. A death that hit her particularly hard. By the end of her shift, she felt emotionally wrung out. The old Shauna would have either suppressed everything until she exploded at home or fallen apart in the break room. This Shauna clocked out, sat in her car, and let herself feel it. Named the emotions: grief for the patient who died, exhaustion from the difficult shift, sadness about the suffering she witnessed. She cried. Let the emotions peak and fall. Didn't fight them. Didn't judge them. After 20 minutes, the wave passed. She felt clearer, calmer. She drove home, told Andrew about the hard day, accepted his comfort, and moved on. That was the real transformation. Not that hard things didn't happen. Not that she didn't feel intense emotions. But that she could feel them without being destroyed by them. Could ride the wave instead of drowning in it. She had learned to regulate, to manage, to live with her emotional intensity instead of being ruled by it. 5 years after her leave, Shauna was promoted to charge nurse. More responsibility, more stress, more potential triggers. But she was ready. She had her skills, her tools, her awareness. She knew when to use stop, when to splash cold water on her face, when to take a break, when to ask for help. She knew how to notice emotions without being hijacked by them, how to find what was underneath, how to choose her response. The emotional dysregulation hadn't disappeared. She still felt things intensely, still had moments when emotions threatened to flood her. But she wasn't afraid of them anymore, because she knew she could manage them. At her 5-year check-in with Dr. Park, now just annual maintenance sessions, Shauna reflected on the journey. Sometimes I'm grateful for the breakdown, Shauna said. Is that weird? Not at all. Why? Because it forced me to get help, to learn these skills. I think I would have just kept struggling otherwise. Would have burned out slowly instead of all at once. This way, I had to face it, had to change. And now you're better equipped than most people to handle emotional stress. I am. I teach other nurses now about emotional regulation, about mental health, about not waiting until you break to get help. Dr. Park smiled. That's the full circle. From struggling to thriving to helping others. Shauna thought about the younger nurse she'd mentored, Taylor. Taylor had started therapy, had learned similar skills, was managing her stress better. She thought about the other nurses she'd talked to about emotional regulation, about mental health, about the importance of getting help. The breakdown that had felt like the end of her career had actually been a turning point, a chance to build something better. She still had emotional dysregulation. Probably always would. Her emotions would always be more intense than some people's. But she'd learned that wasn't a flaw. It was just how she was wired. And with the right tools, that intensity could be managed. She could be a good nurse and someone who felt things deeply, could be competent and emotional, could struggle and be strong. Those things weren't opposites. They were all part of being human. And Shauna Martinez, cardiac nurse, emotional dysregulation survivor, mental health advocate, had learned to be fully human without being destroyed by it. That was enough. More than enough. It was everything. She left Dr. Park's office, drove to work, started her shift. And when the first difficult moment came, a patient upset about treatment delays, Shauna noticed her irritation rising. Named it. Used stop. Found what was underneath. Empathy for the patient's frustration, stress about the situation she couldn't control. Chose her response. I understand you're frustrated. I would be too. Let me see what I can find out about the delay and get back to you within the hour. Is that okay? The patient calmed. Yes. Thank you. Shauna moved on to the next task, the emotion wave already falling, leaving her clear and present and capable. This was her life now. Not perfect, not without struggle, but manageable, livable, good. And Shauna, who'd once thought her emotional intensity would destroy her, now knew the truth. The intensity wasn't the problem. The lack of tools to manage it had been the problem. And now she had the tools. The flood was still there, would always be there. But Shauna had learned to swim. And that made all the difference.